Hello, it's Dr. Tugbiyele again here, your urogynecologist, and in this video we're actually going to talk about the treatment options or treatment solutions for pelvic organ prolapse. So if you've watched my previous video, I went into great detail about what pelvic organ prolapse is, and in this video I wanted to kind of hone in and specifically talk about treatment options. But before we get started, I wanted to describe what pelvic organ prolapse is. Pelvic organ prolapse is loss of pelvic support or loss of support to a number of areas in the pelvic floor. And being a urogynecologist, I take care of women. So when we talk about loss of support, it can be a number of places. And pictures speak 1,000 words. So if you allow me, so here, let's see here. So this is a normal diagram. Okay, we'll look at a woman from the side. Pubic bone here, tailbone here, and this is the vagina in the middle. Uterus is here, and this is the bladder, urethra. This is the colon, rectum, and anus, and these are the pelvic floor muscles, the Kegel muscles, down here. Okay, so this is kind of where everything is normally supported, and I'll kind of flip to this side, where here, this is the bladder that's well supported, and here, this is a woman's bladder that has dropped, okay? And this is called a cystocele, okay? And again, this is a normal diagram here of a patient with a well-supported rectum and vagina, and here, as you can compare, this is where the rectum is actually bulging up into the vagina, okay, and that's called a rectocele, okay. And then here, as we can see, the uterus is well supported. And in this diagram, we can see how the uterus is falling into the vagina, and that's called a uterine prolapse. And lastly, in women who have had a hysterectomy, where the uterus was removed, then the top of the vagina is closed. But sometimes what can happen is that the vagina then sinks down and caves into itself, and that's called a vaginal prolapse or vaginal vault prolapse. And sometimes because of that, the bowel can kind of sneak in here, and that'd be very uncomfortable. And many times, women can have a combination of areas. So where it's not just the bladder that's falling or the rectum that's bulging or the uterus that's falling. Sometimes in some women who've seen me over the years, it can be all three areas competing for that space. So that's kind of pelvic organ prolapse, and why does it occur? Women who've had children, women who've lived life long enough, so aging, heavy lifting, strenuous heavy lifting over the years, vaginal childbirth. There's certain medical conditions that are associated with prolapse, like obesity or smoking, as I'd mentioned before, because smoking accelerates the aging process, and obesity, there's more associated weight on the pelvic floor. Previous surgery is another risk factor. And so there are several risk factors. And what are some symptoms that women experience? It may be pressure, difficulty emptying her bladder or her bowels. I've had patients tell me over the years they have to lean forward to empty their bladder or their bowels. Some women have to manually support to empty their bladder or bowel. Some women feel pressure. They can't start their urine stream. They wake up several times at night because they're not emptying their bladder completely. They feel pressure, pain. It could be low back pain or pain on the lower abdomen. A myriad of symptoms. So it's not comfortable. It's definitely common, but we like to say it's not a normal part of aging, because there are options that are available to women to help them improve their quality of life. And so, getting into some of these options, some women would consider these more natural options. And I'll talk about Kegels and talk about how pelvic floor exercises can help to strengthen the pelvic floor, and I think it's a great prevention mechanism, prevention solution, meaning that especially perhaps before women have their children or right after having their children, I think Kegel exercises and pelvic floor exercises can help to strengthen the pelvic floor. Some women may see a pelvic floor physical therapist who will coach them on getting their muscles stronger, and seeing someone for once a week for about an hour over the course of 2-3 months. And I think there's benefit to that in preventing prolapse or to strengthen the pelvic floor and maintaining support. There isn't the strongest evidence that it can help to treat prolapse, meaning once the process is started, the bladder is dropping, the uterus is dropped to the opening of the vagina, there isn't the strongest evidence that the Kegels will make it go back up against gravity. Of which, and this is another risk factor, we live on planet Earth gravity, so it's not necessarily going to go in the opposite direction just based on Kegels alone. And so that brings me to medical options. And I talk to my patients about medical options such as, or an office-based option such as a Pessary. And I know I talked about this in a previous video, and this is a picture of of several different types of pessaries. I'll bring it closer. A ring pessary, here, dish pessary, there's a Gale-horn pessary. These are devices that are made of silicone and they get fit in the vagina. When it's the right size for a woman, she shouldn't feel it or see it. It shouldn't be too big that it hurts. It shouldn't be too small that it falls out. Just the right fit. And kind of like a shoe that fits and then you kind of forget about it. And a lot of women will find that if they are interested in this option, that they can actually do well with it. It gets fitted in. Some women choose to learn how to remove it, clean it, and put it back, as it kind of have to, in some situations, it would have to be removed for intimate times and then put back. But some women choose to not remove it at all. It can stay in for as long as 3 to 4 months at a time. And then women would come to the office. We would remove it, clean it, put it back for her. So we see a patient once a season or so. And a woman, she's comfortable. She relieves the pressure. She can empty her bladder or bowel better, and she feels better. And we're really here to improve on symptoms and improve quality of life. And if a woman's happy, we're happy. We've done our job. And so a lot of women like this option, but some women may not like the option because it's an addition. They see it as more work. It's a device. Some women are not keen on putting things in there. They're not really into tampons when they were younger, so they're not necessarily into the pessary idea. And some women may experience some discharge and are older with it in place, and some women are not keen on that. And so when it's in place, though, it helps to support the organs. But some women would prefer to have a surgical option. And so when we talk about surgeries, and that is a long conversation, but just kind of condensing it, there are different ways surgeries can be performed. There are vaginal surgery can be performed using a woman's tissues, her natural tissues, and kind of stitching things back up. So whether it's the bladder that can be stitched back up in place, or the rectum that can be stitched back down into its normal position, or the uterus, or the top of the vagina, then those are options. Then there are also other minimally invasive options, because we like to avoid making an incision in the abdomen if we can, and when we can, and in most cases we can, thankfully. So there are laparoscopic options or robotic options to help to support the organs. Again, using a woman's tissues, her natural tissues. However, if a woman is maybe older or her tissues are no longer adequate, maybe she's had prior surgeries that have not worked, then there are situations, very unique situations, where if a woman's natural tissues can be used, then we may have to bring in some additional material or to help keep the organs in place, kind of like a hernia. If a person's tissues aren't good enough, then the surgeon may need to bring in additional material. And that kind of is where we talk about mesh. However, when I say that word, I don't want you to think that it's that mesh. Isn't that the issue? Isn't that the thing that they talked about? So the mesh that we use in reconstructive surgeries nowadays is not the 1-800 bad mesh. It's not the lawsuit mesh, recall, erosions and bleeding and commercial. We're not talking about any of that mesh. We're not placing that mesh vaginally to help to support the organs. What I'm talking about is only when mesh needs to be used, it is placed through the abdomen, and then the meshes can be used. For example, I use mesh to support a woman's tissues robotically. That mesh is then used to support and bring the organs back up into their normal position in a minimally invasive fashion. Oftentimes women can go home the same day or no more than an overnight stay, and she feels better, and the success rates are really high. Now, having said that, I'm so happy and thankful that we can offer surgeries for women, or actually I should say we can offer many options for women that work. Whether it's a preventive option, Kegel exercises, pelvic physical therapy for patients who have mild symptoms, or for patients who prefer a medical option, a Pessary. But for patients who choose a surgical option, there are many options. And so I literally lay out all the options on the table, and I let a woman choose what's best for her. When she's happy, I'm happy, I've done my job. And so, having said that, it's very important for women to seek help when they feel symptoms that they don't know what's going on. They may have noticed things have changed, their bladder or bowel function has changed. Why? Because a lot of women live and put up with these symptoms and don't have to. And oftentimes, with time, things can get worse, and that can make it more challenging to treat. Seeing a board-certified urogynecologist is key, because this is what we do, and these are the things that we take care of week in, week out. I've been a urogynecologist for 17 years. I've cared for thousands and thousands of women, offering options that work and are effective. And so that's something that's very important to me, that I educate women and help to improve their quality of life. Okay, so I've said a lot here and in this video, and it's gone a little over, but wanted to definitely add that value and educate women, because this is very important. And so if you want more information, you can visit my website, www.drdrsteven, Steven with a PH, Tugbiyele.com, and that link will be attached to this video. You can find me on whether it's Facebook or LinkedIn, YouTube, yeah. That's essentially what I want to share in this video. My practice website is www.northsidecenterforurogyn.com, and my office number is 470-325-1280. Okay, if you know any woman who would benefit from this video, benefit from this education, if you wouldn't mind sharing this video and point them to my YouTube channel. It's something that I'm passionate about, educating women, and I thought this would be another medium to reach more women. Okay, thank you, and till the next video, take care, be well.